especially every like 2 to 4 weeks. That's your best defense against coming into a scenario where you're like, wow, 8 months later, this horse has a really bad club foot. What do I do?
All right, good luck. Okay, so now that we have sound again, here we go. We can't do this without technical difficulty. I think technical gremlins are against us. So shall we start the intro over again? Sure. Okay, all right. This is Dr. Ellen Staples. As we've already gone over, she has on a cape and a tiara because she's a superhuman. Anyway, she is a certified journeyman farrier and veterinarian, so that makes her a podiatrist. And she is able to do miraculous things with horse feet. So now that we have everyone on Facebook ready to go, right? Yep. Everybody's ready? Okay. If you have questions in Facebook land, feel free to type them. Just because you don't hear them right away doesn't mean we aren't going to ask them. We sort of save them up for the right moment and we'll ask your questions for you. If you have questions in live land, raise your hand. We'll call on you, promise. Okay, so without further ado, Dr. Ellen Staples.
Let's get started. All right, thanks everybody for coming out. I'm really excited to talk to you guys about what I'm really passionate about, which is equine podiatry. So in my presentation, the majority, if not all of these photos are actual cases that I've worked on. So I know the screen is kind of far away. It's probably better if I stand this way. How about now? Now we're back. Sorry, everybody in Facebook land. Okay, so equine podiatrist, farrier training, trade schools. Some farriers will opt out for several year-long apprenticeships. But specifically with an equine podiatrist, a lot of people encourage a traditional training through a trade school. And with the farrier education, everyone's encouraged to do a certification. So through the American Farriers Association, you can be a certified farrier. The next level up is a certified journeyman farrier. And these are tests that test your proficiency in shoemaking, biomechanics, anatomy, that sort of thing. It's a 3-part test. And then there are different endorsements you can get through the AFA or the American Farriers Association. So I did my training at Kentucky Horseshoeing School, 9 months. I apprenticed there for a year. And then I went to Virginia, Maryland College of Vet Med and did a farrier internship there with Travis Burns, where I did a lot of therapeutic shoeing, gluing, that sort of thing. And then I did my veterinary training over at University of Florida here in town. And so equine podiatrist will have both of those trainings, veterinary training and farrier training. And after I graduated, I did a year internship at Equine Medical Center of Ocala, where I honed in a lot of my veterinary skills. So here today, I'm here at Springhill Wednesday and Thursday. The other days, I have my own podiatry-focused service, and I service the area, mainly in Ocala, but several surrounding areas as well. So what we are often many of you all are here today because you've witnessed and been the first line of defense against the ever-long battle between the horse hoof versus the state of Florida. So over millions of years, horses have evolved to thrive in dry, grassy areas. And this sort of promotes the ideal hoof experience. So they're cursorial species, meaning they run and they move over long distances in slightly abrasive, dry footing. So this creates the scenario where they don't actually need to be trimmed. A lot of shoes and trimming techniques are designed after these wild horses. And most importantly, these horses are subjected to natural selection, meaning the lame ones don't get bred, they get eaten. So a lot of these horses that are reproducing have a lot of the good genetic lines for good feet. So here in Florida, our back pasture often doubles as the scene for Free Willy. So this often will lead to the greatest battle, which is constant moisture. Moisture, I think, in my opinion, is the biggest issue that we deal with here. And specifically, this leads to diseases such as white line disease, diseases such as canker, as well as overall poor hoof quality. So overall poor hoof quality, this can be secondary, as we'll talk about in a second, secondary to things like laminitis, which is also can be related to excess moisture. So a lot of green grass, that sort of thing. So before we get started to talking about the nitty-gritty, I'll just go over some brief anatomy to make sure we're all speaking the same language. So the image on the left is a solar view of a hoof. So here on the outside, we have our nice hoof wall. I don't know if you guys can see my cursor, but just axial or just to the inside of that is the white line. It's the waxy substance produced by the attachment of the bone in the hoof capsule. Here we have our sole from heel to heel. Here we have our nice healthy frog. Here we have the bars, which are the inner reflection of the hoof wall. And then the sulci or commissures, this sort of area in between the frog and the hoof wall. And then our heel or our heel bulbs right here. And then the cross section of the foot, here we have the bony alignment. So the second phalanx, the coffin bone here. Can you all see me if I go back here? So here we have our second phalanx, our coffin bone here, our navicular bone here, our nice, healthy, fatty digital cushion. Here's our hoof wall over here, and then our sensitive and insensitive lamina, which is a really, really important structure. And I'm actually going to refer to it as an organ. So this is a really close-up view of what we call an interdigitation, or the attachment between the bone and the hoof wall. So here, I guess here going back, we have, this is the bone, and this is what we call the sensitive lamella. So there are leaves, and then there are secondary leaves that attach, and they form this really, really strong attachment between sensitive and insensitive tissue. And this organ itself is the target of a lot of diseases that primarily laminitis disease that affects many of the horses here today, or here. So monthly hoof grows at about 3/8 of an inch every month. Some horses grow more, some horses grow less. The hoof growth is primarily dependent on conformation of the hoof. So on the next slide, I'll go over different feet conformation, but here on the left, we have sort of a low-heeled, longer toe horse. This horse will tend to grow a lot more length in toe than heel. So when a farrier comes every 6 weeks, they'll end up trimming a lot more toe than they do heel. And that's primarily due to the biomechanical forces on the tissue itself that's growing the hoof wall. So things that affect hoof growth, definitely conformation. Shoeing can in fact affect hoof growth as well. So there are shoes that we put on, we find that horses grow less in. Some horses grow more in certain types of shoes, but this in the middle here is a package on a walking horse, and genetically a lot of these walking horses have really good feet, but these packages, we see that these feet tend to grow really, really upright, strong hoof wall, and sort of uniform growth all the way around. So the third foot on the right is a really interesting example and something that I see a lot of. And this foot is affected by laminitis. And what you can see here is that there are, I know it's kind of far away from you guys, but there are divergent growth rings. So this is the inside or the medial aspect of the foot. This is the outside. So due to the laminitis and the weight bearing, this part of the foot tends to be shut down, or it grows at a slower rate compared to the lateral side. Additionally, a lot of these laminitic horses will grow a lot of heel and reduced growth at the toe due to the pathology within the foot. So you'll have a foot that sort of grows from the lateral or from the outside towards the inside, and it'll be shut down on the dorsal or the front part of this foot. So hoof growth is a very dynamic process that we can manipulate in a lot of ways to promote healthy hoof wall. So this is a super busy slide, but I just wanted to go over hoof conformation, because what I want you guys to do at home is to maybe take a picture of this or go back and identify what kind of hoof conformation your horse has at home. And that way I can tell you what things to look out for, things that you might likely already deal with or maybe will deal with in the future. So the yellow arrows are pointing towards a normal hoof conformation, so a straight hoof pastern axis, so the line that sort of bisects the whole bony column here. It's nice and straight. Looking from the back, this foot has nice, straight, slightly canted hoof wall. Their frog acts as a secondary weight-bearing structure, so it's not squish right on the ground. It's sort of resting on the ground. And then from the bottom, you see here that this hoof has a nice uniform thickness of hoof wall, nice big healthy frog, a great representation of what a hoof capsule should normally look like. So the next category of hoof conformation, we have our sloping foot or our underslung feet. So this is really common in thoroughbreds, common in warm bloods. So they have, and this often is due to they just have really long pasterns and it's sort of bred into them. But these are the type of feet, like I said before, will grow a lot of toe, reduce growth at the heel. From the back side, this is a great representation of how the frog gets really crushed. It often serves as sort of a primary weight-bearing structure, which is not its purpose at all. And then looking from the bottom, you'll see that the quarters, or this part of the foot, sort of flared out. The heel bulb is sort of exaggerated, gets crushed. The frog, depending on the foot, tends to just be reduced in thickness. These horses will often deal with really thin soles. They'll be really sensitive in periods of excess moisture. You know, from the times between June and September, they'll have pretty sore feet. And then the third category of hoof conformation are these upright feet. And these are really typical in quarter horses, where they'll sort of have a almost broken forward hoof pastern axis where their bony alignment starts and then the coffin bone sort of tips forward. From the back side, it's hard to see here, but the hoof wall is straight up and down on either side, and then the frog is recessed and it actually doesn't touch the ground at all. So from the bottom part of the foot, you have a recessed frog. Often these frogs are really filled with thrush. They kind of are just absent, especially in the summertime. And these feet will be longer than they are wide. And so we see a lot of diseases associated with this hoof conformation. Primarily, a lot of these horses get really sore in the toe. It's where a lot of their concussion is. And then a lot of these horses, not sure why, but a lot of these horses are affected with a navicular disease as well. Any questions about these different types of hoof conformation? Okay. So I wanted to make a hoof disease roadmap. So this is sort of a window into my brain as I'm walking up to a case, especially as we get going. I'm trying to look for the cause. How did we get to where we are today? So this foot on the bottom here is a diseased foot. You can see it has divergent growth rings. Somebody had glued a patch on. It's sort of grown forward. The horse is lame. So how did we go from a normal structure, presumably normal structure, to this diseased foot? So we go from a normal structure to this diseased foot through abnormal structure, through abnormal forces rather. And so these abnormal forces I'll categorize as diseases. So diseases like laminitis, trauma, so things like penetrating injuries, infection, recurrent abscesses, bone resorption. A lot of these abnormal forces include excess length, so having your horse only trimmed twice a year or never being trimmed in its entire life. That's a lot of these abnormal forces, or just poor environmental conditions. Shamu's swimming tank, for instance. So then the other category is maybe what we're dealing with is an abnormal structure. And maybe this foot is undergoing normal forces, but because of its abnormal structure, it can't actually withstand a lot of these. So then we end up at this foot. So a lot of these abnormal structures, these are more congenital diseases or diseases that the horse is born with. This can be poor conformation within the foot. This can be nutritional deficiencies. This is more seen with our brood mares or undernourished horses. And then we can come full circle by starting with a normal structure, going through these abnormal forces, and then all of a sudden ending up in this abnormal structure that can't withstand these normal forces. So what I'll be talking about are abnormal forces applied to this foot. So unfortunately, a lot of us probably here have dealt with the disease of laminitis, which is the acute and or chronic failure of attachment between the bone and the hoof wall. And so here in the image on the left is a good example of a horse that in an ideal world, this bone should be parallel to the dorsal aspect of this hoof wall, and it is in fact rotated. And so these images on the right are really cool examples of a horse that had previously rotated, that has grown out. What I like to say is a good roadmap as to what this horse has experienced. So this is a nice bruise. There's about 2 centimeters of distance between the coffin bone and this. So it's not that the bone is coming out. It's just that this horse rotated, really concussed the bottom of her bone, and that concussion led to bruising, discolored the area, and now that's growing out. So then 8 weeks later, this bruise has been pared away, and now we can see the laminar stretching of that laminitic episode. So it's a good example of what these forces end up doing to the foot or the hoof capsule itself. So we categorize horses or laminitic horses as rotators or sinkers. Rotators simply rotate like that from the dorsal surface. Sinkers, unfortunately, are a little tougher cases. They will either just sink down completely separating from their entire hoof capsule, or they're more commonly just sink on one side. This is a good example of a medial sinker. So the outside is that part of the foot. The coffin bone is sort of canted to the inside. You see this, I don't know if y'all can see it, but there's a gas opacity between the hoof wall and the outer portion of the coffin bone here, indicating separation. And these cases are a little more difficult to deal with. So we categorize the cause of laminitis into 3 different categories. The first most common category is endocrinopathic laminitis, which is a long word essentially for saying horses that have really high insulin for whatever reason. So these are your metabolic horses. These are your PPID/Cushingoid horses or Cushing's disease. The insult with this cause of laminitis is really high insulin. It acts as like a direct toxin to that nice interdigitation between the sensitive and insensitive lamina. So this can be an acute episode. Acute episode would be like an injection of a steroid that causes a really high release of insulin, therefore causing mechanical failure, or it can more commonly be a slow sort of positive feedback loop with insulin resistance, so systemic resistance to insulin in the body, which then tells the body, hey, we need to make more. So then it's a positive feedback loop where these horses then just make a bunch of insulin. And horses have an insane ability to make a lot of insulin. So the second, less common category cause of laminitis is septic/inflammatory laminitis. These horses are your retained placenta horses, colitis horses. Some colicky horses have this as well. The primary inciting factor with this is the release of endotoxin, so release of bacterial components that directly target the lamina itself. This category also lumps in road founder or really intense prolonged trauma with feet. So historically, a lot of road working horses, you can see this. Here in Florida, I've actually seen multiple times where horses will get in an ant pile in their hind feet and kick and kick and kick and kick, and then they end up causing inflammatory laminitis. The third, less common scenario cause of laminitis is contralimb laminitis. And this is where a horse is really, really lame in one foot, and then it puts all of his weight on the other. And this directly causes ischemic or hypoxic damage, meaning that a lack of oxygen to that really important organ that attaches the two structures. So what's unique about the horse's foot is that big fat digital cushion in the back acts as like a blood pumping mechanism. So every time the horse steps up and walks, it pushes up the used blood, and then new blood gets to come back down, the new oxygenated blood. So horses that sit on their left hind all day because they're really lame in their right hind or their front foot will often have ischemic cause of laminitis. So some examples of these, this horse on the right, I will let you guys guess as to, maybe a bigger version would help. What kind of laminitis do you think this guy has, just looking at him? Endocrine related. He's a chunky monkey. So that was more of an acute on chronic episode of laminitis. And a lot of these horses will present maybe to us as maybe they're only lame in one foot, but actually it's affecting both foot. They're just more painful in one versus the other. This middle picture here is kind of your typical laminitic stance. Horses that don't really want to move, they rock back on their haunches and, excuse the water fountain in the corner, rock back onto their haunches and relieve a lot of the tension on their forelimbs. And this here, the video on the right, one of my most favorite patients, this horse bilaterally sunk medially. This is sort of during her rehab period. This is probably 3 to 4 months after the incident. She's overall really reluctant to move in the forelimb, and then she actually has secondary pelvic limb pain, so pain in her haunches from rocking back on her haunches for so long. Nope. So abnormal forces continued. Oh, it's already said. Okay. We have the foot on the left is a penetrating wound, so often roofing nails. We find a lot of roofing nails. Other penetrating wounds this predisposes the foot to infection of that area. Sometimes they can cause fracture, that sort of thing. The horse in the middle actually has really wonky conformation due to a previous knee injury. This is an old broodmare, thoroughbred broodmare, and her hoof capsule, I put a lateral extension on to help support the limb, but it grows in a really wonky direction. Also, to add insult to injury, she has a really bad club foot on her other foot. So we go back and forth as to which foot is more painful, which limb is more painful rather. So poor conformation or abnormal loading of these feet can cause lameness. And then this video here demonstrates, I don't know if you guys can see, but this 2-month-old foal actually had prolonged laxity. I had glued extensions on him in the hospital shortly after he was born, and he continued to be lax for about 3 to 4 months. So this can cause a lot of stress on the hoof capsule as well as other structures, but that need sort of intervention podiatry-wise. Other abnormal forces, I'm sure a lot of us are familiar with white line disease, so sort of infection of the hoof capsule. And it's actually a misnomer. White line disease doesn't directly affect the white line. It actually infects the non-pigmented, what we call stratum medium, or the big, thick part of their hoof wall. There's a pigmented part, which is what we see. Once you rasp down all the way, you get to white hoof wall, and that's actually the target of white line disease. So a lot of these horses become really sore, and they can actually have laminitis or rotation because of complete failure because of the bacterial infection. So treatment of a lot of these horses, you have to resect it, unfortunately, expose it to air. You can do topical treatments, that sort of thing. Abnormal forces, like I said before, excess length. This horse is dealing with a little bit of laminitis. And then, so there's excess length in the middle and then excess trimming. So this is a donkey foot, and he just been repeatedly trimmed and trimmed and trimmed to where his coffin bone is very close to the ground. So going back to our hoof disease roadmap, we sort of covered some abnormal forces, but I'd like to briefly go over abnormal structures that have normal forces applied that then lead us to where we are today. So these are things like poor conformation of the hoof capsule, nutritional deficiencies, as well as previous diseases, like I stated before. So the foot on the left, this horse, or it's a donkey, I think, he's missing a big portion of his coffin bone. A lot of resorption, a lot of disease. Donkeys are really resilient in general, and so they put up with a lot of disease in their foot. So you can see that a good portion of his coffin bone is missing. Consequently, the missing portion of his coffin bone, there's a missing portion of the attachment of his hoof wall. So these horses that have really small coffin bones actually have a reduced surface area of attachment, which predisposes them to just being a lot more sensitive to these normal forces applied. This here is an early stage of a club foot. I think this horse is about 6 months old when this photo was taken. These club feet, generally, if they're not too bad, horses actually do pretty well with club feet. Things that we run into are sensitive toe. They have reduced sole depth in the front half of their foot, and that's primarily due to the contraction of the big tendon that inserts onto that coffin bone. So prevention of club feet are really important in the early stages of their life. Primarily, we can manage it through podiatry interventions. If there's nothing we can do, we go to surgical intervention for a lot of these horses. And then another thing that affects overall hoof growth or hoof capsule is keratoma, which is a benign tumor of the foot that grows sort of in between the hoof capsule and the bone, and typically it grows from the I guess we don't really call them progenitor cells, but the stem cells, I guess, of the hoof wall, those origin cells. And you'll see a lot of these keratomas will widen at the bottom because they sort of pick up and grow more tumor as it grows down. And the presence of this tumor between the hoof wall and the bone actually causes pressure necrosis, or pressure and therefore destruction of bone in that area. This causes hoof disease because it weakens the attachment between the bone and the hoof capsule in that area. And so a lot of these horses experience recurrent abscesses in the same area. You'll actually see a deviation of their white line on the solar or the bottom view of their foot. And then we take x-ray and you say, oh, okay, well, there's a big keratoma. We surgically remove these if the presence of the tumor is actually causing them consistent prolonged lameness. If it's sort of oh wow, he has a keratoma and he doesn't have any lameness, then we just let it be. Another another abnormal structure is just nutritional deficiencies. So this hoof here on the right is a quarter horse broodmare that I think probably had like 97 foals at one point and has just been bled dry. So she had really shelly hoof quality, sort of cracks, that sort of thing. She actually had just been shipped in from Oklahoma, so I would imagine she was on like a dry lot out there, and here in Florida, a lot of those cracks predisposes her to having severe hoof disease. So what does this all mean for you all today? So hopefully what I've done is sort of expose you in a typical 101 class fashion. It's probably left you with way more questions than answers. But what I hope this has done is sort of identify the possibilities or exposed you all to some of the diseases that we deal with a lot of horses around here. And for your own personal horses, what do you deal with concurrently? Does your horse previously or currently dealing with laminitis? What are some things that you have to do that is unique to this horse to make sure you don't come back into the cause or this recurrent cycle of laminitis. Is your horse a really thin-soled horse? Does this mean you have to go out there every day? I have a picture of a wire brush because I think this is the most important tool I have on my truck. And I highly encourage you guys to get it. It's $1 at the hardware store. But what I like to do is, I live in Micanopy. The mud is really, or the ground is really muddy. I take my horses in and I wire brush their feet and put them in a dry stall for 12 hours. And I think a lot of the horses, even though we deal with a lot of prolonged wetness, if we can get them in a dry area, and it doesn't even necessarily have to be a stall. You can do a run-in shed with nice mats and some in an area where you can clean, or even if you don't have a run-in shed, providing a mat where you sweep every day, where horses can stand while they eat their breakfast. Maybe when they're eating, you can pick out their foot, that sort of thing. Once you start looking at your horse's foot every day, you can identify some of these issues and then catch it before you have to call me. Because I love to see you guys, but you guys don't like to see me. So another really important thing that Springhill does an excellent job of is routine wellness care. So having a veterinarian looking at your horse twice a year. We see hundreds and hundreds of horses every year. So we see a lot of these diseases, and we can catch them at early stages before it's too late. So this routine wellness care involves endocrine testing. So a lot of your metabolic horses or PPID horses. Here in our senior wellness package, we include testing of ACTH, or an indicator of whether or not your horse's Cushing's is being controlled with medication. Also, routine radiographs. I know it's expensive, but an ounce of prevention is worth a lot of money. So having baseline radiographs for horses that you know have disease, this really helps your farrier. I cannot tell you how many times a farrier will just hit their head against the wall and saying, there's something wrong with it, something wrong with his foot. We take an x-ray and he or she can look at it and say, oh, okay, I can fix that. I've got a tool in my truck, or I've got a shoe in my truck. We can fix that. And with that, regular communication between your veterinarian and your farrier is super, super important. So they see something, hey doc, I think that, Miss So-and-so needs you out here, or, we go the other way. So, hey, let's call your farrier, let's attack this issue before it actually becomes a big deal. And if you're experiencing issues communicating with your farrier, I'm here. So I speak the language. I know a lot of what their perspective, a lot of their issues are, so we can attack these issues in a more realistic manner, versus sometimes I think a lot of the communication gets lost because us as veterinarians, you're not the one underneath the horse. You don't see what's possible, that sort of thing. So if you're one of the lucky ones that have never had a foot issue, I don't know where you are, but what I please ask of you is please prevent obesity in our horses. Preventing obesity in turn prevents laminitis. And this isn't just feeding your horse a quarter scoop of senior. This is eliminating the senior and then putting something like a ration balancer inside of it, because just a quarter scoop of senior actually doesn't give your horse the essential nutrients and minerals that it needs. This leads to the sort of nutritional deficiencies. Ration balancers are specifically formulated to have little to no caloric content, while also providing your horses with the necessary things for it to grow a nice, good hoof capsule. So ration balancers are super. Like I said before, preventing excess moisture, so creating a dry area where your horse can come in and out of, that sort of thing. Picking your horse's feet every day. I know it's a pain in the butt, or a pain in the back rather, but it's really important. This way you can identify issues before they're actually an issue. And a lot of these horses, especially our low underslung feet horses, applying drying agents just a few times a week, especially in our wet seasons. So here in Florida, between the months of June and September, on average, our annual rainfall is about 50 inches a year, and it rains like a little over 100 days out of the year. So it's a lot of moisture, but these drying agents such as Durasol or tincture of iodine, that sort of thing, are really good topical. And I apply it to the sole, sometimes into the frog, but primarily into the sole to help prevent a lot of softness in that area. And then, like I said before, veterinary wellness visits. So having your veterinarian come out, make sure your horse isn't getting too chunky or too skinny, sort of going over a lot of routine things that are just really good for your horse in general. And then routine hoof care. I'm actually almost done. So routine hoof care, having your farrier out every 6 to 8 weeks, super, super important. So I know in this area, we don't have a ton of farriers, but those that are here, really, they need you to provide a good working environment, a flat working environment, ideally concrete. If there's no concrete, an area where you have rubber mats, ideally it's covered, that sort of thing. So take care of your farrier and they will take care of you. So routine hoof care is very, very important. So with that said, I'm done. You had a question.
What do you put up the hoof armor for keeping their feet dry?
I'm going to repeat the question because I don't think Facebook Land can hear us. The question was, what do you think of the hoof armor for like daily application?
It's a 2-part like epoxy almost that lasts for 2 weeks.
Mm-hmm.
And I tried that this summer, but I didn't know if I could use it regularly. I mean, I did cure the white line.
Mm-hmm.
Just had to be dry while I throw the cracks.
Mm-hmm.
But can I keep applying that, or is it like an acrylic nail where it's going to break down the hoof?
I think anything that is sort of trapping the foot in, so anything that prevents moisture from coming in also prevents, like the foot itself produces moisture. So when we cover feet with pads and stuff, I will always put like a drying agent and an antibacterial agent. So usually like copper sulfate, oakum, that sort of thing, in between the foot and the pad. So any long-term use of things that completely cover the bottom of the foot, with the exception of shoes and pour-in pads, I probably wouldn't recommend for long-term use. Yeah?
Is that the same as Keratex?
The question is that the same as Keratex? The hoof armor product? It's different.
Okay. How often should you use Keratex?
I don't personally use Keratex
And why is that?
because I use things that work a little better. So my wire brush works really well and Duracell works really well. For the really difficult cases, there's a product, and I'm not endorsing any product, but I guess I am. There's Hawthorne Products makes a different percentage of tincture of iodine. So I use this kind of widespread with a lot of cases where soft tissue is exposed. You don't really, especially Duracell, I encourage you guys to either wear gloves. You don't want to always expose your skin to it because it is carcinogenic, meaning that it'll give you cancer.
And I was told by I keep my horse barefoot and then do Keratex.
Yeah, no, I think if it works for you, I think, barefoot is the ideal for a lot of these horses. By nailing into hoof wall, we sort of compromise their hoof structure. But unfortunately, a lot of these horses can't go barefoot for various reasons. They sort of have that abnormal structure category. So glue-ons, I glue on a lot of stuff, especially therapeutically. Glue-ons are really nice. I found that the best scenario, if we have to use shoes long-term, the best scenario is a nail-on, especially here in Florida. I'm a big fan of indirectly glued shoes, so shoes that aren't glued exactly to the bottom, but are glued to the outside of the hoof wall, that sort of thing. So shoes, they're not called sigafoos anymore, but they have a cuff on the outside and you glue them. That prolonged use of that, and I have horses that have been in them for years, their hoof wall tends to be a little thinner because every time I apply it, I have to get it really, really clean, and you just millimeter by millimeter thin that hoof wall, and by the time it gets to the bottom, over a year period, it's actually really thin. So the ideal scenario is nail-on, but knowing that with my nail-on shoes, I actually can't provide as much support on the back half of the foot as I can with glue-ons, because if I have a lot of steel or even aluminum hanging out the backside, I can't fill the areas with glue to prevent the horse from stepping on it, that sort of thing. So glue-ons tend to stay on better in certain circumstances, but I like the long term to be more nail on in this certain environment.
I'm going to give you some Facebook Live questions, which will also have to repeat because they can't hear my microphone, so sorry.
Okay.
Okay.
Do you want me to just read them?
Well, there's one of them.
Okay.
Yeah. How do you promote growth of a deep sulcus crack?
A deep sulcus crack. So in my head, I think there's a crack in the hoof wall, sort of right in the commissure or the side of the frog. The question was, how do I promote hoof growth? So regular trimming, you want to prevent bacterial overgrowth of the area. So exposing the area, you possibly have to apply antibacterial topical things to the area to prevent bacterial overgrowth, and then providing a lot of growth, unfortunately, and this is more seen with laminitic horses. Horses just stand in the stall. They don't tend to grow as much. There are a few exceptions, but horses need to move around to grow. So promoting them to move around a little more also helps.
What does it mean if the frog starts to point one direction or the other as opposed to straight down the middle? And can this be correct?
It's a good question. So going back to our hoof disease roadmap. So if I'm looking at a foot and I see the frog is sort of going to the right or the outside of the foot, I'm thinking, oh, there's probably an abnormal force applied to this foot. What could possibly be this? So I would put the foot down, and usually I do this before I pick up any foot. I watch the horse walk up. I say, oh, is that foot directly under those knees or directly under the fetlock? That horse likely has some sort of either rotational issue or angular issue to where the forces applied to that normal hoof capsule are just a little different. Luckily, it's easily corrected with a swipe. The frog is easily corrected with a swipe of your knife. So you take off that area of the frog. Hopefully it's not the sensitive part of the frog, but at every cycle, probably that frog just sort of deviates out. You trim it back to the ideal, and then it grows out in that same direction every time. Now, these horses aren't perfect. A lot of really successful athletes are a little bit crooked here and there. So unless your horse is lame, it's probably not an issue. But if your horse is lame, it might need things like something that'll affect the landing, so an extension or a little more support via a shoe in one direction or another. But I would definitely, this horse would be predisposed to hoof cracks, that sort of thing, because that normal foot structure has a bunch of abnormal forces applied. So it might break off sooner on one side of the foot versus the other. So routine hoof care would be specifically important for this horse.
And we're going to put a couple questions together here and come up with one big one. It's how do you address the negative angle? They said plantar, but Palmer's kind of the same deal. And when we do that correction, can we transition them away from that correction? And if so, how? Like, can that horse go back to her foot at some point?
It's a good question. And I think it's a battle that I've got to repeat that question. So that question is, in a nutshell, horses with negative plantar angle, plantar being feet in the hind legs, / palmar angle. And they're specifically talking about the angle between the coffin bone and the ground. So horses with a really positive angle, their coffin bone sort of sits like this. Horses with a negative palmar angle sit sort of like this. And so there's a lot of concussion on the back half of that coffin bone. And the negative palmar angle in the forelimbs actually, I think, biomechanically are much different than negative plantar angle in the hind limbs. So a lot of horses, and I'll go to the hind limbs first. A lot of horses, in my experience, actually have a 0-degree palmar angle. The ideal is between 3 and 5 degrees, and that's just a blanket statement for all front and hind feet. In my experience, I find that a lot of these hind feet are actually at a 0 degree. They have a little lower palmar angle. And lameness does often arise when they have a really negative or sort of tilted back palmar angle. It's difficult to fix these, and it's my opinion that the only way to fix them is through intervention with x-ray. So having your veterinarian out there at the same time as your farriers out there, they take off the shoe or they go and trim the foot, and the goal is to trim as much toe because there's no heel growth when they have a negative palmar angle. It crushes the heels, and just like these forces, when they're crushed, they don't receive a lot of oxygenated blood, and the structures can be compromised. So they end up crushing their heels. So you end up trimming a lot of toe consecutively. And it sounds really scary, but a lot of these horses that I see for the first time, negative plantar angle behind, I'll take off their shoes and I'll trim them, and I'll actually trim to where they slightly, I call it sweating them, but the tiny little capillaries in their foot, they'll bleed just a little bit. These horses aren't really sore, and I don't like, it does. It scares the tar out of a lot of people, and every time I do it, I get a little uncomfortable, but in my experience, what I've found is this is where we need to go every time until we promote good hoof growth. And so I don't think that every time we trim this foot, we need to get blood, get a little bit of blood. I'm not saying gushing blood at all, but this is the limit to where this horse can go. And if we can't get it ideal with a trim, these horses will need things that will help the growth of their of the back half of their foot. So it's kind of a long answer. You opened up a huge can of worms. But it's a fun mental exercise, because what you then want to do is you want to relieve the stress on the heel, the back half of the foot. You want to throw stress on normal healthy structures. So that's like the frog, the digital cushion. So a lot of these horses, short-term and long-term, will go in things like a heel plate with impression material or material that's kind of cushy, that'll fit between the shoe and the bottom of the foot. And this promotes, I guess in my head, I look at more as like a artificial digital cushion. So a lot of these horses that are negative, they crush that healthy digital cushion structure. So then we're replacing it with this dental impression or impression material. And the goal, and you don't necessarily reach this goal with every horse, but the goal is to relieve the stress on the heels to get them to start growing again. And then hopefully over time, with correct trimming practices, and I'm still in hind feet land, correct trimming practices, you can get more of a 0-degree angle, maybe even slightly positive angle with a lot of these horses. Yeah, there's a question here.
So how far in the system line can you take that back to promote that heel growth? Because for my particular horse, she ended up with long toe no heel in layman's term. So the bars are forward now, and they need to be like back about almost a half an inch. So the toe has to come off on a regular basis. But you know that white, now the white line is white. I thought it should have been called the dirt line for my whole life in Florida, because it's being trimmed correctly. But how close can I get to that?
So the question is, how far can we take the toe, and how much hoof wall can we take off before it becomes uncomfortable or dangerous for the horse? We don't want to make it worse, definitely. And that's a fine line that we play, and it honestly depends on whether or not you're putting on a shoe. So if you're barefoot, I don't recommend you completely exposing what we call the non-pigmented stratum medium, or the non-pigmented part of their hoof wall, that white area, that bright white area, not the waxy area. So you don't want to completely dub off their toe, because if you remove that weight-bearing structure, it can destabilize the hoof capsule pretty significantly. But what I really like to do with a lot of these horses is I'll do a lot of my trimming actually with their feet on a foot peg from the front. And so I'll rasp a nice 45-degree bevel from the front. And by providing this bevel, if it's big enough, you can reduce that length between the tip of their bone and the tip of their hoof capsule incrementally over time if that bevel is pretty big. But honestly, it takes a while for you to do more aggressive trimming in the beginning, and then you can sort of normalize it.
So once they progress to that, it's not an automatic fix. It's a gradual.
It's a
process.
gradual, yeah. It's a really gradual process.
So can you take the bars all the way back to where they should be?
No, because
Work on those little by little.
because the structures in the back half of that foot are particularly crushed, if you take that insensitive tissue off more, you have to take it down to sort of straighter. You have to take it down a little bit, because if it keeps on growing forward, that sort of crushed area of their hooves keep moving forward. You have to take it down to where it's slightly straight, but you really just rely on the future growth or the future biomechanics of that. And so usually, like I have specifically I'm thinking of a saddlebred horse that I'm working on, and I think I'm in setting 2, and out of 1 trimming cycle, and he was super wedged up. He had and this is in the front end actually, very negative palmar angle. I sweat him in the toe, put a shoe on him, and then that quick change in biomechanics, actually that horse grew a little bit of heel. I was able to put him on a nail on with a wedge pad. That's the controversial thing, is do we wedge these horses up or not? And it depends on the performance needs of that horse. So when we wedge them up, we increase the pressure on the back half. So you wedge them up, they rock back on it, and that actually decreases heel growth. It increases concussion on the structures in the back half of the foot. So the growth is reduced. And so long term, you see horses that are wedged up. They don't tend to, it's not a solution. And a lot of these horses don't get fixed. They get to a point where they can not be as lame. But so what I like to do is not wedge them up, unless they're subluxated, not wedge them up, and then over time, just do as much as I can to hopefully get them to be 0. Because unless in a very specific, special case, they often will never be +3, +5. And then other things that you can do, is doing things like a rocker toe. I probably rocker 100% of these horses if I have the sole depth. Rocker the toe, that brings that point back even farther. Rocker the toe, roll the toe, that sort of thing. Rockering is when you take the tip of the shoe and you tilt it up so the weight-bearing structure of that foot comes towards the center of the bone.
All right, common question from Florida. How can I combat constant crush?
It's a good question. And I'm going to repeat it. The question is, how do we combat the constant issue of thrush here in Florida? Regular trimming, getting your horse trimmed every 6 to 8 weeks is really, really important. And the primary function of that is you're removing a lot of the hoof, primarily the frog. You're removing a lot of the frog that sort of traps in those areas that trap a lot of that gross dirt. So your farrier goes in with a knife, takes out that extra, and exposes that nice commissure. In addition to regular trimming, get out your wire brush at least once a day, and things like Thrush Buster are good, Duracell. If it's really, really bad, sometimes horses will stand in foot baths with different antiseptic properties in it, that sort of thing. That's one thing I really love. If you guys steal my wire brush, I can go buy a new one. It's not that big deal, but I love it. Yeah.
I keep hearing 6 to 8 weeks, but I've always done 4 to 5 weeks.
Yeah. A lot of actually the horses that I do are 4 to 5 weeks. 6 to 8 weeks are more for backyard horses, that sort of thing. 4 to 5 weeks are for performance horses that really rely on the appropriate function of their foot, especially if you have horses with previous disease. Laminitic horses, they really rely on kind of a shorter trimming cycle. It's counterintuitive because you want them to maintain a lot of the good hoof growth that they have. But every time your farrier comes, they slightly change the biomechanics for that growth to happen in the good areas and not the bad areas. And so having horses on a shorter trimming cycle actually reduces a lot of the stress. It's a good, very good question. Yeah, there's a question in the back.
Anything in particular for donkeys that we need to be aware of?
Donkeys are lovely donkeys. They're awesome. Donkeys are very unique. They're very tough. Like I said before, they deal with a lot of foot issues. For some reason, we don't know why. Maybe related to their genetics. There's a genetic cause of Connemara ponies with white line, but donkeys are really prone to white line disease, and we don't know why. And we see it. I've lived in a couple different places throughout the country, and it's not just here in Florida, it's everywhere. So again, having your donkey regularly trimmed, they function with a baseline of white line disease a lot. The extreme cases are when your donkey will rotate because of the failure between its bone and the hoof capsule secondary to white line. So that's when you get into trouble. But getting your donkey trained so you can pick up the feet and clean them out, that sort of thing. And donkeys are hard asses. So I know a lot of you don't like to have your donkeys regularly trimmed, but it is a really good idea to train them to have regular farrier work done. And if they're not trainable, if you're having difficulty, Better Living Through Chemistry, dormosidane gel is an incredible drug that a lot of donkeys learn to love because they don't really know what's good for them, unfortunately. But regular trimming is the biggest defense against donkey issues. Yeah. Yeah, same schedule. Yeah, another question.
I have an older horse, she's always had insults.
Mm-hmm.
In the last month or two, her soul, much more.
Like recessed?
Yes.
Mm-hmm. So the question is, somehow I remember to repeat the questions there, but here, I don't know. The question is, in the past couple months, my horse has experienced a concavity or a recession of the sole or aspect of her foot. And this is pretty common in this area. We go through an incredible seasonal variation of moisture content. And so what happens is your horse's foot is just like a sponge. It contracts and expands in relation to the moisture. And so that concavity of the foot is a combination of the wear of the sole, but then also that tissue or that sole shrinking due to the reduction in moisture content of the ground. Some horses, and I see it more in horses that have a longer foot for some reason. I don't know why, but horses with kind of shelly feet. I thought I had a photo in here before that their hoof wall sort of turns in and is a little shelly. I see a lot of that there. So. If your horse isn't lame, I wouldn't worry about it. Yeah. Just have your farrier look at it. Yeah, that sort of thing.
All right, you're going to be here. Your questions. Send you but a minute.
Welcome.
Go all the way out.
Yeah.
Okay. So we're going to be here to answer questions. You on Facebook, we're going to try to get to all your questions, but we're going to call it good for this evening in terms of questions we answer. But we will look for yours and type answers for you. So I want to thank you guys all for being here so very much. And thank you guys for being here on Facebook Land. And yeah, we may see that.
Thank you guys for having me. Like Dr. Letcher said, I'm here Wednesday and Thursday. I hope this is just phase one of podiatry stuff. Hopeful future topics includes laminitis, that sort of thing. So look out for that in the future.
And we can also find you under Canopy Equine, right?
Yes, and my business is Canopy Equine. Here.
Like
Thank you all very much.
Canopy.
Yeah, like me Canopy.